Okay, let's just dive right into this explainer, shall we? Today, we are going to transform the often incredibly confusing world of spirometry into a simple, automatic reflex. And we're going to do it using the power of memory chunking. Honestly, if you've ever stared at a pulmonary function test and felt a sudden wave of anxiety, you are absolutely in the right place. We are tossing out the massive, complex textbooks today, and we're focusing purely on how to build an unbreakable mental framework using mnemonics. Yup, 30 seconds. By the end of this explainer, you're going to be equipped to accurately interpret literally any spirometry result in exactly 30 seconds. We're going to pull this off by using some highly specific, high-yield mnemonics that will permanently anchor these core concepts right into your long-term memory. You know, it's really all about working smarter, not harder. So here is the quick roadmap for the memory palace we are building today. First, the 3 magic numbers. Second, obstruction, air stuck inside. Third, restriction, the small box. And fourth, the 1-minute memory algorithm. Let's start with section 1, the 3 magic numbers: 1, full, and ratio. For our very first memory chunk, I want you to completely forget about all those complex mathematical graphs. At its core, spirometry fundamentally just measures how much air comes out of the lungs and how fast it gets there. To memorize our first key metric, FEV1, just think F literally equals first. It's simply the volume of air forced out in that crucial first 1 second. If a patient's airway's narrow, well, the air's going to come out slowly, right? And so this first number drops. Boom, that's your first mental anchor. Next up, we anchor FVC by remembering F equals full. This is the full total volume of air that is forcibly exhaled after taking the absolute deepest breath possible. It essentially tells us the total capacity we're actively working with. If the lungs just can't expand normally, or if some severe blockages are trapping the air inside, this full number is going to fall. Now, here's where it all comes together: their relationship. The FEV1 over FVC ratio is easily the single most important number you'll look at. Whenever you check this ratio, I want you to always ask yourself one simple question: is the road blocked? Because if the airways are obstructed, that first second of air, the FEV1, falls so much more drastically than the full volume does. And think about the math for a second. When the top number of a fraction drops faster than the bottom number, the whole ratio goes down. Moving on to section 2, obstruction, air stuck inside. Just remember, O means out is difficult. To really build a strong spatial memory map here, we have to split the entire spirometry world into 2 totally distinct halves. Obstructive simply means you cannot get air out. Restrictive, on the other hand, means you can't get air in. Whenever you're looking at a test result, don't overcomplicate it. You are literally just playing a basic sorting game between these 2 distinct buckets. Okay, so how do we memorize this obstructive bucket? Just think back to grade school and remember your ABCs: asthma, bronchiectasis, COPD, and cystic fibrosis. In every single one of these conditions, the tubes are physically blocked, the air gets out super slowly, the FEV1 plummets, and as you'd expect, that crucial ratio we just talked about drops low. Now, if you are forced to actually look at a flow volume loop graph, don't panic. There's a brilliant visual cheat code for that too. All you do is anchor the word obstruction to a scooped out shape on the expiratory limb. Imagine a giant ice cream scooper just taking a massive chunk right out of that downward curve. Obstruction equals scooped. It's that easy. All right, section 3, restriction, the small box. R equals reduced volume. For restriction, I want you to imagine the lungs are trapped inside a tiny, rigid box, and they just can't expand adequately to get air in. To remember the causes, just memorize the letters PFN. That stands for pulmonary fibrosis, fluid or pleural disease, and neuromuscular or chest wall causes. Notice the difference here? It's not that the tubes are blocked, it's that the actual physical box holding the lungs is simply too small or too rigid to move. This right here, this is the mechanical heart of spirometry. Notice how obstruction practically guarantees a low ratio, simply because you can't get air out fast. But with restriction, it's a totally different story. Because both the FEV1 and the FVC drop proportionally, meaning you have less air overall, but the tubes themselves aren't actually blocked, the ratio magically stays preserved. Sometimes it even goes slightly high. Let's bring it home with section 4, the 1-minute memory algorithm. R, F, B, T, C. I want you to recite this 5-step sequence with a deliberate rhythm so it really drills into your head. R, F, FBTC. This little sequence will systematically walk you through any result you encounter. Step 1, check the ratio. Step 2, check the FVC. Step 3, look for bronchodilator reversibility, which just tells us if those airways can actually open back up. Step 4, check TLC, or total lung capacity, to confirm restriction. And finally, Step 5, apply your ABC or PFN causes. Listen, if you lock only one single sentence into your memory palace today, it has to be this one. Ratio first, low equals obstruction. Ratio normal plus FVC low equals restriction, check TLC. That is your entire diagnostic pathway beautifully distilled into a single, elegant string of logic. If FVC is low but the ratio is totally normal, it is a massive red flag pointing toward restriction. But, and this is key, you absolutely must check that total lung capacity to officially prove that the box is actually small. Let's clear out all the noise for one final rock-solid brain anchor. O stands for out, and R stands for reduced volume. Obstructive means you literally can't get the air out, so the ratio drops. Restrictive means a reduced lung volume, so the FVC drops, but the ratio stays completely preserved. By trusting these mnemonics, the first, the full, the blocked road, and the RFBTC sequence, you have successfully turned what used to be a mathematical headache into a quick 30-second reflex. But honestly, it really begs the question, if this historically complex pulmonary test can be mastered with just a few simple memory chunks, what other impossible medical topics are you just one good mnemonic away from conquering?